This podcast represents the opinions of Katie Allen, PA, and guests of her show. The content is for informational purposes only and in no way sets up a patient relationship. Consult your healthcare professional for any medical questions. Now, here's Katie Allen.
This is Make Me Pretty Podcast, and I'm your host, Katie Allen. I have with me today
Ben Abebe.
And he is a PA in urology. So today we are talking about erectile dysfunction. When it comes to urology, it involves both men and women. You're really probably dealing more with the males, females. When we're talking about sexual dysfunction, probably that's more GYN and other sexual health folks. But when we're talking about this.
Yeah, I consider the erectile dysfunction, a lot of issues that we see sexually of our men coming in. Consider it the couple's disease, where it's not just affecting that man that's in the clinic with us too. Oftentimes they're coming with their partner, or they're there by themselves and trying to figure out, how can I do this, improve myself for my partner too. So while the prescription or plan or treatment plan is going for that specific male patient, it involves the couple, with their male or female partner. So I can always appreciate their input and their, and happiness and enjoyment as part of our treatment plan as well.
It's important. What brings a guy in to see you, or what is normal and what's abnormal?
It varies. When we figure out what's normal and abnormal, there are some things that we see in general trends. As we get older in age, yes, the libido can vary. The reliability, the consistency of performance can vary too, just as we kind of go beyond what most may figure out are our physical peaks. Now, what we need to worry about is, again, how it affects your enjoyment, your sexual health. Our sexual health is part of a component of our mental and our physical health. So if your sex health is not in check and it's giving you a lot of stress, that can affect you negatively in other ways too. Now with guys, a lot of things is trying to make sure that I'm able to perform, maintain firmness, and be there when I need to be for my partner and make sure that I'm enjoying it too. That's the goal most people are finding. And when it's beyond the point where they're lacking that consistency, they're lacking that ability to satisfy their partners, then they feel that's considered abnormal, and this is where most folks will come to us for help.
So let's say they're seeing their primary care provider. What's a phrasing that men can say without maybe feeling resistant to it?
The phrasings are varying from different levels of comfort and basically rapport that the patient will have with their provider. Because when it comes to talking about sex health, a lot of guys, we can already be stubborn just to get seen by a provider. Exactly. And then when it comes to our manhood, so to speak, it can be a very sensitive topic where we have a lot of our ego attached to it. A lot of guys will, whether it be in locker room or teasing each other too, a lot of, part of my language, but dick measuring can occur where your performance will determine who you are as a man. Yeah. And so when it comes to a point to admit or to acknowledge, that there is something that you need help with, it almost feel like the guy will feel like he's less of a man for doing so. So a lot of guys will talk about performance or their ability to get it up or the ability to satisfy their partners. What are tangible things what's occurring from their erections themselves or lack thereof. So that's usually a way they'll kind of bring it in. They'll say, I'm noticing these changes. I'm not able to do what I was able to do before. And then they're just there trying to, what can you do? Yeah. A lot of guys will come in a little more informed than others too, but getting them on the right path and what to focus on, I think, is key.
So they're coming in to see you and saying, I've got these things, these changes that are going on, and then you're assessing them. You and I had talked a little bit before you even get to the physical part that there can be a psychological aspect, and that is where having the support of a partner is also good.
Yeah, and usually there can be a psychological component where physically they're fine. Often, I'll see a guy worried about his performance with a specific partner, where he'll feel like
don't use that one. Just don't use that partner.
And so with that, sometimes there can be some lack of compatibility where the guy will say, I'm able to perform on my own, or I've performed fine with another partner. Well, everything's in order. His body physiologically is doing what it needs to do. But now there's some mental block that he's having with this new partner. And so that can be a little bit tricky, especially in these short formats that we have in medicine where it can be a lot of churn and burn. Yeah. Then at those situations, we need to have, a dialogue between both partners. And it's always tough because there's no one language that all partners to have when they communicate with each other too. It could take time or be short periods of time as well.
That dang communication again.
Exactly. And that can be a key portion of dealing with those mental blocks. I would not keep one partner out of it. Even if things are going well, I always want to make sure that both partners are informed and they're on the same page.
You had said, in addition to them coming in and talking to you, there are some other therapists that specifically address things like this too?
In medicine, we always try to look into resources that if we have available. A sex therapist can be very helpful to have if they are accessible. They are usually a very good resource to utilize when we're talking about longer term discussions that are a better format just for people to get these thoughts out. Some folks will just be wanting to know questions about, is it okay that I'm not performing as I have been? Is it okay to have certain desires or libido or act on them too? Which we don't always address well on the urological side, within the medical side too. So having a sex therapist can be helpful to talk out or discuss the goals between a person themselves and their partner in a lot more thorough dialogue than we don't offer.
More time is offered really in that
Exactly.
setting.
Yeah.
When it comes to the actual physical aspect of erection, are guys coming in and saying, okay, I have a decreased libido before you get into actual functionality? Is there something that urology can offer them for libido?
Yeah, within libido, and it's all about how it affects their goals too. Some guys will say they'll have vice versa, where the erections are there, they have the ability, but for whatever reason, they just don't have the drive to act on it, whether it be with their partner. And that can be a really tricky conversation, especially without the partner being there. But with libido, yes, we always do looking into things that there are things that we look at medically, making sure that someone's is hormonally in check. There are a lot of different blood panels that we do. Primarily, very commonly, we look at testosterone panels and making sure that their sex hormones are in check too. Because if those are out of whack, which can adjust and fluctuate naturally over time, it's definitely a component that we wouldn't ignore completely. But certainly, yes, if someone's able to having imbalanced hormones, sex hormones, and we're able to optimize them to an appropriate range, oftentimes, not all the time, we can find that their sexual response is able to be essentially into a better spot than it wasn't before too. So it's a good tool. But oftentimes too, people can have perfectly normal hormone levels, and we still have to do a little more intervention as well. But that is one thing that we look into, is their libido and how we treat it.
When is the libido typically affected in a male?
I find that once guys hit the age of 40, that's where most folks will start to come in and having to address these issues. Everyone's different. You can definitely have guys.
That is so young. My gosh.
But it feels like it's getting younger each year. There are, on the other extremes where guys will be even as young in their 20s and even 30s too can experience this. And of course, as we get older, the libido, the erection quality is expected to drop down. So I'm not too excited with we're hearing a new complaint like this from a guy in his 70s and 80s. But if it's a concern for him, then we adjust it. It just happens to be most notable for guys in their 40s because it feels like just a couple of years ago or just yesterday where things were raring to go and they felt like they were the full, complete version of themselves. And then when it's such a stark decrease to their performance, they can feel like, what am I doing wrong? Or I'm not the same guy I was, when they really were. It is a lot of pressure, whether for their own ego or to help their partner or a combination of both. It can be very, very stressful.
Mm-hmm. Which I'm sure that does not help as well.
No, it just exacerbates that issue too. It's kind of like you get stage fright or just performance anxiety.
Yeah.
And then now we're just trying to get to a spot where we're telling guys that, hey, what you're experiencing is okay. Let's take off the additional pressures of that you're doing something wrong. Let's just focus on, let's quiet all this outside noise and just figure out what can we do and does it fall in line with your goals too.
As far as the physical part of it, what are some things that you can offer them to help with an erection?
With regards to what guys can do, I like to be pretty straightforward and keep things rather basic. The good thing is the things that we do for improving the quality of our erections, everyone should probably be doing anyways, erection or not. And that's the basics, making sure that you're having good lifestyle habits, making sure, number one, that your sleep is in check. If a guy is having, whether due to work or school or life stressors, and he's getting 2, 3, 4 hours intermittently for a week too, his libido is going to tank. His erection quality is going to be really poor too. And that's something that we don't want to overlook, is the quality of sleep. On top of that, we want to make sure that your diet is in check, which is very broad, talking about, eating whole food sources, trying to avoid a lot of processed foods, going to the grocery store, making your own food, and staying away from a lot of junk food that's out there. Regards to diet as well, if you definitely want to help improve your performance day to day, cutting back on alcohol, the aforementioned whiskey dick is a real thing. So looking into the things that a guy is doing himself, any of their vices, or tobacco use, cigarette smoking, and smoking cessation.
Shrinks
and also
those blood vessels down.
Exactly. Because we see that with erectile dysfunction. While I don't stress too much if a guy is okay and he's not worried about his performance, it can be considered a marker of early cardiovascular disease too. So if experiencing ED, it's important not just to ignore it completely, but making sure that his cardiovascular health is in check and he's following all those appropriate preventative measures too. Those are the things that I would say, what are the things a guy can do now? Now, to measure, to see how strong a guy's erection, while usually guys are pretty in tune to what they're capable of doing. But there are ultrasound tests that we can do to get an actual diagnosis where we can determine exactly how much blood flow is going into the penis. Is way more than the amount of blood flow leaving out of the penis as well. And that gives us an actual diagnostic. But generally, it's just more of another picture that we can have. But oftentimes we can get away with just having that discussion and going off of the guy's dialogue of how is performance doing for them? Are you just simply happy or not? And how are we doing about that?
Okay. So the ultimate goal is that they are pleased, really, right?
Yeah.
That's what you're hearing back. That's what you're
exactly.
telling me.
We're just trying to get you to that end point as best as we can.
And then what are some things that you're able to offer medically?
This is a very big space in men's health. Again, like I always chime in first, those lifestyle measures are the things I always want people to max out as best they can. Because any of these options that I mentioned now, you still have to take care of yourself. You still have to eat well, be physically active, manage stress, get your sleep too. We don't want to hamstring ourselves by just having medications be the crutch for us. Very commonly, number one, we always often offer, provided the guy is not having any issues with other medications, or oral medicines like your Viagra, your Cialis. There are these category of medications called PDE5 inhibitors. They're very common for good reason. They're really easy to use. They're a tool in the toolbox, and most guys will find that they'll have a good on-demand, momentary response to it at the time of sexual intercourse. Going down the list, there are some a little less appealing treatments for guys too. There are penile injections that a man will do where he'll inject medication into his penis.
Ouch.
I know, but it performs a lot better with the strength of the erection and kicks in a lot faster. Generally, guys won't dive into that unless they fail the pills, but that's another treatment option. Going down the list, there are intraurethral suppositories. Guys will use a prescription medication to insert a jelly or a tab or a dissolvable tab into the urethra. That can also promote an erection. There's a lot of these prescription medications that are in that space. Once these have either failed or not available to us or just not an option for us, then it starts to get a little more involved. Outside of medications, guys can be very commonly use vacuum erection devices or these kind of penile pumps that can help to promote an erection. Like I mentioned before, looking into making sure the his sex hormones are in check too. Hormone therapy, testosterone replacement. If a guy, we feel that he's a good candidate for it, can certainly be a tool to help to restore some of his erectile function and libido. But all else fails, all roads will lead to more surgical procedures, a rather, long process that we want to make sure the guy is appropriate for it. But penile prosthesis, or an implant, where we're basically inserting a device into a man's penis to give him the erection that he wasn't having from before. So there is a pretty standard pathway, and not a whole lot has been added to this space. There's newer avenue of these wave therapies that are often, increasingly across the U.S. and internationally, where
who's performing those?
You'll very often see them in, some urology clinics will offer them, usually private practices. A lot of private concierge medicine, more types of aesthetic clinics will getting into that space too.
Are they done at aesthetic clinics by a really pretty female?
Sometimes they could be. They can make a very appealing product too. But it's another tool, and I'm a big advocate for everyone, for men's sexual health and sexual health in general too. And so knowing that, I don't think that there's enough options out for everybody. I think it's good to have that resource, despite its lack of availability, as costly as some of these may be.
Yeah, but you're seeing some benefit maybe from the combination of things. Back to the pills, because that seems to be something that's utilized so much. when they're using the pills, are there certain things that they need to avoid to help them work better?
I usually say with the medications like the Viagra, Cialis, I like to make it easy to follow. It either works for you or it doesn't. Yes, there are ways that your provider should be telling you how to work your way up the existing dosages. You definitely don't want to overdo it for a couple of reasons. Sometimes you can have some pretty bad side effects, sometimes as mild as a headache or nasal congestion. Or if a guy tries to overdo it, he can have what's called a priapism, which is a really great erection, but it's a very painful erection. It will last more than 4 hours. This will be a medical emergency and you have to go to the emergency room. And there can be some pretty awful procedures that we have to do with needles and drainages to get that.
Close to an emergency, so they got to go.
They got to go. It can be a pretty bad experience for some folks.
And this goes back to the part where you had told me even off the mic, or better if couples are involved, because both people need to understand that needs to be dealt with.
Exactly. And so again, our male patients are there to please their partner, male or female. And so we want to make sure that, all right, what can we do safely to increase your performance where you and your partner are both satisfied? And so, yes, the other things too, beyond just taking care of yourself, the medication is either going to work or it doesn't. There are some things that people can play around by. Sure, if you're trying to make yourself perform, not taking the medication with any alcohol, making sure the timing is right, experimenting with the timing, whether it be an hour, 2 hours before perform.
That's the part of both people being involved too,
Exactly,
right?
Exactly. And if you're having out with dinner or drinks, being just kind of, enjoying life, just sort of spontaneously, that can sometimes make the timing of how these medications work be the most efficient. But if it's working and you're happy, that's all that needs to matter.
That's the end goal.
Yes, the end goal. If it's not working and it's not reliable, I say we move on to the next option.
It sounds like, again, from us talking a little bit off the mic and stuff, in general, if folks are questioning whether or not there's something going on and whether or not something can be done about it, the best is to seek counsel, which would be urology, especially with the males. I really appreciate you coming in and talking to us about this, and I look forward to us hopefully discussing that more in the future, right, Ben?
Of course. I'm
glad
to have
But this
you.
was a great introduction to erectile dysfunction. And the biggest thing that I'm hearing is don't ignore it, address it. Until next time, thank you for listening to Make Me Pretty podcast. You can follow on Instagram at katieallenpa, and you can get to Ben at
I am Ben I am.
And I am going to have that listed underneath. If you will follow, add a review if you don't mind on the podcast, that would be great too. And we look forward to talking to you in the future, and hopefully we'll get Ben back for more information. Bye-bye.
So long.